we have discussed the generation of the transduction potential. We have discussed the action potential. We have discussed the release of the neurotransmitters from the first order neuron, and then the entry of the neurotransmitters to second order neuron, so that a further action potential is generated through the second order neuron. We must also discuss a little bit about, at the level of the spinal cord or at the peripheral level, some sort of modulation we have discussed. But the conduction of the action potential through these actions, either first order neuron mostly, that can be inhibited. That can be inhibited or facilitated. Now the blocks of the conduction through the first order neuron, that depend on the type of the nerves. If it is a beta nerve, there are three types of nerve. One is A, one is B, and another one is C. So there are three factors, mainly some external factors which also interfere with the block of the nerve fibers. What is hypoxia? So this hypoxia, it affects the B nerve fibers mostly, and intermediately A nerve fibers, and C nerve fibers are least affected with the hypoxia. There are also another factor is pressure. If pressure is given on the nerves, say for example, when there is a disc prolapse, when there is a tumor, where there is some pressure effect on the nerves, then we have found that mostly this pressure affects the A nerve fibers mostly, because it is myelinated, it is a thickly myelinated. There is dysfunction of the A nerve fibers. So the touch and the motor, this proprioception, joint sense, fine touch, all are inhibited. And for the pressure, the least affected is C. So C is affected least, C practically is not affected. That's why during the disc prolapse, the C function is pain. So the pain is not inhibited. And there is practically the pain means it is not due to dysfunction, it is due to normal function. So to reduce the pain, decompression of the disc is probably, we have to think, probably may not be appropriate. But if there is motor weakness, if there is sensory loss, if there is bladder and bowel problem, then probably we can understand that A fibers have been affected by this pressure, by the disc or other things. Then the scope of decompression of the surgery and these things comes in. We also know that there is local anesthetic agents. For the local anesthetic agents, they mostly block the conduction of the C, because these are thin, because they act on the sodium channels. So the sodium channels are blocked, it is open, there is no myelination, and so all the sodium channels are blocked. So immediately the pain and the C fiber function is blocked by the local anesthetic. But in the medium, the B is not blocked. That much, or it is intermediately blocked, and it takes some time to block the A nerve fibers, or we have to give more local anesthetic with a more concentration. Now we must also discuss a little bit about two things. One is IPSP and another is EPSP. EP is excitatory postsynaptic potential and IP is inhibitory postsynaptic potential. This IPSP is inhibition, EPSP is facilitation. If there is a nerve, say for it is mostly seen in the motor nerves. There are the presynaptic nerve ending, which takes the information to instruct these motor nerves for contraction of the muscles. And if there are some presynaptic inhibition, so there is another inhibitory neuron, sometimes it presynaptically attaches with this first order neuron or the primary nerve, which is giving instruction to the motor nerve, and this is called presynaptic inhibition. This presynaptic inhibition is mostly caused by GABA, the liberation of the GABA. This liberation of GABA, that means what it does, it increases in the presynaptic membrane, it decreases the entry of calcium, so the calcium will not be able to enter inside. And also it increases conduction of chloride. So chloride from outside will enter in, and it increases the potassium. So potassium will go out. So ultimately the inside will be more negative, and that's why it will not release the neurotransmitters. So this is presynaptic inhibition by GABA, and this GABA, this action mostly by this chloride and potassium and also by the calcium, this is potentiated or by barbiturates. This is potentiated by benzodiazepines, and this is potentiated by alcohol. So these all actually acts by secreting more GABA through this pathway. Now, say for example, we can discuss a little bit about this presynaptic, this excitation and inhibition at the level of the motor neurons. To understand the facilitation and the inhibition of these nerves, it is best studies we can discuss the local reflex circuit with the motor neurons. At the level of the spinal cord, we know this is the dorsal horn, this is the lateral horn, and this is the ventral horn. At the level from the ventral horn, the motor neuron starts. There are many motor neurons here which will come out through the ventral root or the motor root to innervate the muscles for the contraction. We know through the sensory root or the dorsal root, the nerves will enter into the dorsal horn cells. Say for example, there is a lower limb bone, and there are some muscles are attached to move the joints. Any joint can be moved by two opposite muscles so movement of the joint needs one protagonist muscle and antagonist muscle, the synchronization of these two movements. This is the tendon. We have discussed earlier that there are muscle spindles these muscle spindles are stimulated with the stretching of this muscle, and once the muscle spindle is stimulated, these A fibers, A alpha fibers, they will go inside in the dorsal horn, and it will actually facilitate or stimulate by releasing these glutamates, so that the motor nerves for that muscle is stimulated for contraction, because there is stretching, and so that it now contracts. So this is called facilitation. Simultaneously, if the muscle is and this also at the same time, the same fibers from the muscle spindles which actually sends the information to the motor nerve to stimulate the same muscle, at the same time there are also inhibitory neurons, and they also stimulate the inhibitory neurons, and these inhibitory neurons will release glycine, and this glycine will actually, they will dampen the action potential. They will dampen the action potential in these motor nerves. So the motor nerves for the antagonistic muscle is inhibited. So this muscle spindle at the same time it facilitates the protagonist muscle, and also it inhibits the antagonist muscle. There are also at times when the tendon is stretched too much. It is often seen in a senior patient who is having maybe an osteoarthritis, and when the patient starts to sit in the chair, and gradually there is a controlled relaxation of the quadriceps and controlled this contraction of the hamstrings together. So this quadriceps, when there is contraction, there is also controlled contraction, otherwise he or she will fall, and this initiates strong enough contraction, initiates the stretching of the ligaments, these tendons. And when there is a significant amount of stretching, it beyond limit, then suddenly this GTO or Golgi tendon organ, this was muscle spindles. So the Golgi tendon organ, these nerve fibers or these receptors are stimulated, and it will go through the DRG to the dorsal horn, and this will suddenly, this will inhibit through a inhibitory neuron. So it will stimulate the inhibitory neuron so that the inhibitory neuron relaxes the muscle. So sudden relaxation, immediate relaxation of the quadriceps, and there is a giveaway and the patient falls on the chair. So this is often seen, and so we can say that this GTO or the Golgi tendon organ, it stimulates the inhibitory neuron, interneuron, to inhibit the contraction. And so this is in a nutshell about the IPSP. So this is EPSP, this is IPSP, and so this is also accordingly the inhibitory neurons inhibit the postsynaptic potential.